Welcome to Voices for a Healthy Legacy, where we discuss health and wellness with relatable medical professionals in an effort to improve generational health outcomes. I am your host, Dr. Andrea, a board certified family medicine physician, and today's guest is Dr. Fatima Robertson. Welcome to the show, Dr. Fatima.
Thank you, Dr. Andrea. I appreciate you.
Yes, I am so happy to have you here. I have been trying to get you on for so long, and I'm so glad that everything aligned so we were able to do it. I want you to share your knowledge and so the people can see your beautiful face, your wonderful personality that's mixed along with all the professional things that make up Dr. Fatima and why so many people love you. So welcome, welcome, welcome.
Thank you so much. Thank you for having me. I
Yeah.
certainly appreciate it.
Yeah, so just share a little bit about who you are.
Well, I am Fatima. I am a board certified periodontist by day. By night, I am a mom, a wife, a business person, an entrepreneur. I consider myself to be a little bit of a fashionista, consider
Yes.
myself to be a little bit of a comedian. But overall, I'm just a child of God, and I just I like to have fun, and I like to live life well and out loud.
Great, great. All wonderful things. So we'll just have a general conversation and kind of
Sure.
tell our audience what inspired you to go into the healthcare field. Everybody has a story, so tell us about yours.
So I actually, when I was in high school, I actually wanted to be a pharmacist. And
Really?
so, yeah, I did. I wanted to be a pharmacist, but then I found out how much chemistry was involved in pharmacy. And I had that first or that second chemistry class and ran into organic chemistry in high school and thought, you know what, I don't think this is for me. So
Mm-hmm.
somewhere around my sophomore year, my dad was like, you know what, you might want to consider looking at other healthcare fields. Well, I just so happened to be actually going to my dentist because my mom had some dental problems that she was getting fixed around that time. So I just
Mm-hmm.
happened to hang out with her at some of the appointments because she was really afraid to go to the dentist. And so I had to go and hold her hand and, kind of talk to her and just kind of make her feel comfortable.
Yeah.
So the gentleman that she was going to was like, you know what, you should think about dentistry. You really should. He's like, you got a good aptitude for it. So why don't you go ahead and consider dentistry? And I thought, you know what? I don't know if I want to be in somebody's mouth, but it sounds cool. Can I work 9 to 5? And can I come home? And can I
Right.
own my own business? Because that was important. Owning my own business and being able to work 9 to 5. I didn't want to be a physician like an ER physician or a gynecologist or something like
Uh-huh.
that where you get called out of your bed. So that was how I got introduced to dentistry.
Okay. So it sounds like you didn't mind the dentistry, but you still wanted to have your own life, set your own terms, but still be able to enjoy the profession.
That's right. I knew I wanted to be a mom, but I
Mm-hmm.
also knew I wanted to be a business person. So I knew I
Okay.
wanted to have my own business. I knew I liked to talk to people. Knew I liked to take care of people. I knew I liked math and science. I knew I was good with my hands. So
Mm-hmm.
let's just start there. My mom actually was a person who was a seamstress, so she could basically sew just about anything. She could just look at it and put it together. And my dad
Really?
is absolutely. And my dad is actually a carpenter, not by trade, but it was just something that he was self-taught. And so
Mm-hmm.
they're both very good with their hands. And so as a result, when I combined my love for science and my love for using my hand skills, dentistry was just a natural fit for me.
Gotcha. And so
Yeah.
now I see where the fashion part comes from.
My
So,
mama.
so when you were little, did you like ask her to like did you see something and say, "Hey, mom, can you make this for me?" Like, how? What did you get any of that when you were younger?
Listen, I was making baby doll clothes for my friends probably when I was about 10 years old. That's when I really started. I had like a little store. On Saturdays,
Really?
my friends would come and and sit in my garage, and I would take them through a fashion show. I would put all the clothes on my dolls, and then they would buy the outfits for a quarter or $1, whatever they had. I just was happy that they were picking them up.
Oh my goodness! Look, so you this has just been running in your blood since you were much younger.
for sure.
So a lot of people don't know the difference between a dentist and a periodontist. So can you tell us the difference between the two and how you may have gone from dentistry to being a periodontist?
So all periodontists or all dental specialists are actually dentists first. So we
Okay.
have to complete that 4 years of dental school, and then we move on to individual specialties. Some people that don't move on to individual specialties just remain a general dentist, but they can still do anything that they choose to do. As a
Okay.
periodontist, what I do is I specialize in treating diseases of the gums and bone. I place dental implants. I actually replace missing bone tissue, missing gum tissue. So those are the things that I do as a periodontist. So I basically do some of the things that general dentists don't want to do. So people often call me the boogeyman, or that's what I tell the patients I am.
Now you're saying that because we want people to be comfortable coming with you, but I know your personality just draws people anyway. But I'll let you tell kind of the framework beneath the surface of things. So kind of tell us a little bit about that.
Absolutely. As a matter of fact, you'll never see what I do. You'll never see my work in the mouth. Everything that I do is underneath the gum line. So I really set the foundation for what your dentist is going to build on top of. So I call myself really the foundation worker. So
Okay.
you won't even see my work unless you take an x-ray.
Okay. Look, and it makes me think about when you were saying your dad is a carpenter and he just kind of picked it up. You just took a little bit from both sides. You're building things up, you're putting a little fashion spin. You do some cosmetic things as well. So people,
Yes,
yeah, so that's like pulling that in too. So you just keep going with it.
I was the combination baby. I really was.
Oh, wow. Now, you mentioned doing things beneath the gum line. So, what are some symptoms of gum disease that, common things and then other things people may or may not think about?
So, some common symptoms that you might see if you have gum disease are that your gums may bleed, your teeth may move. Sometimes they'll shift and change where they normally were. So, let's just say that you didn't have a gap between your teeth initially. As time goes on, you start to develop gaps between your teeth. You start to catch more food between teeth that you didn't normally catch between. That's because teeth are moving. Teeth that are shifting, sometimes if there is not a partner where the tooth is on the top and there's no tooth on the bottom, sometimes that tooth will shift down just because of the loss of bone. So those are some of the things that people may see. You may also see bumps like pus pockets or something like that. Sometimes
Mm-hmm.
people also report that they'll have like a funny taste in their mouth, like you're
Okay.
sucking on coins. But what that is it's the blood, it's the iron coming out of the blood and tastes like coins in your mouth.
Right. And
Yeah.
so, having said that, well, with teeth shifting, and I'm sure there's a difference, some people may say,
Mhm.
well, maybe I just need braces. But is it a different type of shift versus your teeth just kind of doing their own thing? Can one tell when they need to maybe consult with their dentist and maybe eventually come to you?
That's the important thing because you can't really tell when teeth are
Oh,
shifting due to disease or whether they're shifting due to like age or just
mm-hmm.
something like that. So the important thing is to go into your dentist and get an x-ray. And if you do need to see a periodontist, they should send you on.
Okay. I've often heard people say, well, gum disease is hereditary. Is that a thing, or is it where you may have some of those same dental habits as other family members, or is it really a hereditary thing?
So, number one is multifactorial. So, yes, there
Okay.
is a genetic component to it. So, if you have that written on your DNA, you probably will get it. So, the other thing about that is that when you're younger and your parents kiss you, periodontal disease, just as well as cavities, are transmitted by saliva. So, that may be a factor as well.
So when we kiss
That's,
our babies and our
oh my
toddlers, I
gosh.
don't have a toddler, but I do have
Yes.
little ones in the family. Really?
Watch who kisses your child. Absolutely. Just do a quick Google search on it and you'll find all kinds of information on it. But watch who kisses your child. Don't let people just kiss your child on the face or even on the hand just because the babies put their hands in their mouth.
You know what? I'm just thinking. I mean, usually it's family who's doing that just out of love, but you don't
Yes,
think you're spreading the bad things through the saliva. You just don't think about that.
absolutely.
So
But
how
they've done
can
some
we
studies on it.
go ahead? You
I
said
was just gonna say they've done studies on it, and so with it being multifactorial, you've got to consider that if it's on your DNA, it's gonna probably happen. It's gonna be expressed somewhere later in life because of the transmission of the saliva to the child that can precipitate and create that situation. And then if your parents have poor dental habits, then you could potentially develop poor dental habits. And then that's another factor. So, right. So, back to your initial question, that would answer that question. But then, secondarily, absolutely, you definitely have to watch who kisses your child.
Okay.
I'm
Well,
sorry.
thank you for enlightening us all because we just do it like just out of love and innocence, not thinking
Absolutely.
about it, but it makes complete sense. I've just never put the two together. So thank you for
Absolutely.
enlightening us on that. So, what are the risks of gum disease? Like, if you just let it go and leave it untreated, some people I've heard say, well, I just don't have good teeth and it's bound to happen. But why should we really be concerned about letting gum disease just do its own thing and not have any type of intervention?
Well, 50% of the population has what we call gingivitis, which is not necessarily gum disease, but it's definitely the pre-stages of gum disease. It's
Okay.
just inflammation of the gums. And then about 35% of the adult population has what we call periodontal disease or gum disease, and that's where you begin to lose the bone. Now, you shouldn't
Mm,
let that go because periodontal disease is definitely a precursor to other things. So, we always look at what it does to the heart because that bacteria that actually are functioning to create periodontal disease get into the bloodstream. We found tissue specimens of people that have died where they've done postmortem exams. We
hmm.
found the same bacteria that are responsible for gum disease inside the aorta of those patients. So
Wow.
we know that your heart is filtering all that stuff out. We know that it definitely functions in things like diabetes. We know that it's what we call a comorbidity for diabetes
Hmm.
because that bacteria that tend to eat away at the bone tends to create situations where there's a focus of infection, and then diabetic patients don't heal very well from that.
Right.
So it definitely has a lot to do with that. So it's not good to let periodontal disease move forward and
Right.
progress forward because it's a focus of infection in your body. And although you can't see it, it is extremely dangerous.
Because a lot of people think that, oh, it's just my teeth, and you've just like put all of that to rest because it affects our overall health. And the more comorbidities you have, probably the more serious. Well, we need to take it serious anyway, but it can really set us up, to be in a bad position. I don't. What's your advice on how to educate people in the community about the importance of taking care of your teeth? Because I've seen where people kind of
Mhm.
look at that last. What's your advice on how to encourage people um to just take care of their teeth?
What I actually have done is I do a lot of community work. I do a
Mm-hmm.
lot of health fairs with my sorority. I do a lot of health fairs with my church.
Okay.
I also have a big push where I actually go to family medicine doctors and endocrinologists and try and explain to them because sometimes it's not really understood that
Right.
even though the whole body health is there, sometimes patients that do have diabetes or patients that have periodontal disease, particularly with endocrinologists, that I need to be a part of their care team because
Mm-hmm.
those patients may be in an endocrinology office because they can't control what we call their A1C, which is their level of diabetic control. But
Mm-hmm.
what they don't often understand is that if the teeth are not looked at, because there's a focus of infection there, you'll never be able to control the A1C or get it dropped if you only use medication. You've got to look at the entire patient. So some of the things that I do are just community based. And then I also have a big push to talk with endocrinologists and family medicine doctors. I actually try and get in front of them as much as I possibly can.
Great. And it's so needed because they can hear us saying it, but they know that we're not a dentist or a periodontist. So they're just like, okay, well, I'm just focusing on this right now.
Hmm.
But to pair the two together to be able to stress, hey, we're a team. You can't look at one without the other. This is your overall health, not just, this or that. So that is
For
good.
certain.
And comment a little bit on, you don't have to go deep into it, but I've had a lot of patients who neglect seeing the dentist once a year or twice a year because they don't have dental insurance. And I don't know everybody's situation, but I always tell them, well, at least find out maybe how much one visit is and maybe save throughout the year, or take 6 months to save. Then you can go, and then after you have that visit, start over again to try to make it twice a year. So, do you have any recommendations, or how you, I know you're not insurance, but that's a huge thing of what I see with patients as to why they don't see a dentist, and then they get to the point where they decide to, and they're advanced and they have to see someone like yourself.
We offer a member savings plan here in my practice, and it
Oh,
was
good.
basically born out of that same idea, that same concept, because not a lot of patients are insured. Some patients are insured but underinsured, grossly underinsured, just like
Mm-hmm.
medical. So, what we do in our office is we actually establish a care plan for those patients and tell them, listen, even if you want to have 1 or 2 cleanings done a year because you need it, you probably need 4, because we know that with periodontal disease, that maximum amount of time that you want that bacteria to aggregate is probably 90 days. And
Okay.
so, what we tell patients is, listen, even if we can't remove it every 90 days, at least every 180 days. And what we do is we do a bare minimum cost. We just take off things like fluoride, which is not necessarily fluff, but we take off all those bare minimum things. We establish 1 exam per year, 2 cleanings, and then a set of just arbitrary x-rays that we think that we'll need to be able to help the patient figure out if they need additional care, and be able to maximize that by putting it in their or planning for it, putting it in their, putting the cash in their pocket and planning for it.
Right.
So that was actually born out of that situation where we realized that some patients just are underinsured or just not insured at all, just to
Right.
try and help increase the affordability for care.
That is awesome. That's awesome. So we know that, you are a business, but you still have a heart for the people, to be able to want
Absolutely.
them to be able to have access. I'm not in the area, but I'm sure they appreciate you for that.
Thank you so much.
Yes. So let's talk a little bit about the basics. So, brushing and flossing to prevent gingivitis, gum disease, all of that. A lot of people have beautiful teeth, but they may not necessarily have the best dental practices. So,
Mhm.
can you talk about the importance of that, and how often we should be brushing and flossing, and maybe if we have to increase it based on different things? Will you talk a little bit about that?
Okay, so I'm going to say some non conventional things, right?
Okay. Okay.
The first thing that I'm going to say non conventional is that you absolutely should be brushing twice a day. Absolutely. But if you're going to choose one time to brush, you always want to brush before you go to bed at night. And that is because there's a lot of food in your mouth from the day. You always want to remove that food, because when you close your mouth, the best place that bacteria love is a warm, dark, moist environment. And
Mm.
so that's when it goes haywire, and that's when it replicates, and that when it becomes bad, that's when it becomes bad for business. So if you are going to brush, if you are going to spend at least the 3 to 4 minutes it takes to clean your mouth appropriately, if you're going to do that one time a day, do that at night. I always tell my patients, please brush twice a day. But if you're only going to give me one time, do the best job that you can the night before you go to bed. Secondarily, if you don't floss, I liken it to going to do number 2 and not wiping. So the
Oh,
next
you
time,
are really just people don't forget that. I'm sure they don't forget that.
and that's why I said I'm going to say something non-conventional. So the next time you do decide to pick up a piece of string floss and you do floss, take it out of your mouth and smell it. And that's what your breath smells like on a consistent basis.
Okay.
So
Wait.
please floss and brush.
Now, should we floss once a day or twice a day? In the morning
So,
or night, if you had to pick a time of day.
so as a periodontist, I'm flossing once, and I'm a periodontist, but I
Okay.
spend the majority of my brushing at night. I spend at least 4 or 5 minutes doing everything that I have to do at night. In the morning, I'm spending the 2 minutes, 3 minutes, but at night, I'm removing all that food that's between my teeth. So in the morning, you really shouldn't have to do that. You should really just be doing something to freshen your breath and just kind of cleanse what has already built up at night.
Okay. So let's go back. So you said we should be, because so you said at night you probably do 4 to 5 minutes. How do you get through that? Do you turn on your favorite song? What are you doing to pass the time away? Because that feels like a long time.
Listen, the 45 minutes goes by really fast. I'm gonna tell you, I'm gonna give you my secret. I am a Mary J. Blige fan.
Okay.
And so all I do is turn on one of my Mary J. Blige songs. I'm cleansing, moisturizing, putting on everything that I'm gonna put on my face, doing everything I'm gonna do to my eyes, putting on my lash serum. I brush my teeth, and then I stand there with my string floss and I'm wiggling. But I know that by the time Mary J. Blige goes off, I've flossed, I've brushed, I've done my face, I've done everything that I need to do to take care of my body. That way, when I go to sleep, everything's clean, and I wake up in the morning, and I don't have to spend a whole lot of time doing everything that I need to do in the morning. Because in the
Okay.
morning, I'm concentrating on my hair and my makeup, right?
Right.
So I don't have time to do all that in the morning. So I'm doing that stuff at night.
Okay. Well, thank you. Now we just need to pick if we're a Mary J. Blige fan or whatever our favorite song is. We just that helps to pass the time away. You're getting a little, motivation or wind down.
Yes.
But just make it a part of your nighttime routine to just put that amount of time, into it. So
Yes. And anything that you do for 21 days is going to become a habit.
yes, yes. So
So
we need
21 days, commit to it. It'll become a habit.
Okay, look, that sounds like we need to do a 21-day challenge. Look, we'll talk about that. We may do that. Now let me kind of shift just a little bit. So, we hear a lot about natural remedies and gum disease, oil pulling, and what's another one? I can't think. I'm sure you've heard of a lot of them. And I mean, there may be pros and cons, and I know we shouldn't get away from the basics, but there's been some kind of conflicting information floating around. So what are your thoughts on that?
I'll say this. As a periodontist, we're very evidence based. That's just how we're trained. So if it's not on paper and it's not clinically significant, meaning that there is a definite change that we've seen in a majority of the population, then we don't necessarily believe it to be a fact.
Mm-hmm.
So with oil pulling, most people believe in it, but I say anything that I can do to get you to pay more attention to your oral hygiene, please do it. So if you believe that oil pulling works, I'm all for it. I don't have a problem with it. We talk about what is it? Fluoride. Some people believe in fluoride. Some people believe that it's poison. I am just of the mindset that fluoride is one of those things that we need to try and keep us from having more cavities because we are drinking more bottled water now. So we
Mm-hmm.
don't have the inclusion of the fluoride because we're not drinking tap water unless we're using it with our food. We're cooking our food with it. So
Right.
I'm just of the mindset that we probably still need a fluoride, but some people don't use it. And I'm okay with that. But whatever it is that I can get you to do to pay more attention to your oral hygiene, I say I'm all for it.
Okay. And what about stress? Does
Mhm.
stress affect our dental health at all? Which that may be multifactorial as well, but what is
Mhm.
your take on stress and how it can affect your teeth?
It can definitely affect your teeth. So it does have a tendency to make you bleed more because your immune response is a lot lower when you are
Right.
stressed, when you're experiencing chronic stress. In the case of if you have a chronic illness or you are a caretaker to someone that has a chronic illness for a couple of different reasons. If you're a caretaker because you're taking care of the other person, you're not paying more attention to yourself, then you got the chronic stress of being a caretaker.
Right.
Yes, absolutely. You're immunocompromised. You've got lots and lots of issues. We just had a patient a couple weeks ago taking care of his daughter. And similar to that, he had never had any issues before, but all of a sudden he pops up and he's got like 20, 25 bleeding spots. And it's because, not necessarily because there's a lot of plaque on the teeth, because there wasn't, but there was a lot of hard deposit there, which means that it had been sitting there for a number of months and he
Mm-hmm.
just hadn't been able to get in and have it taken care of. And that's because he was taking care of someone that was ill. So stress does definitely has it's a bi-directional relationship from what I see.
Gotcha. Okay. So let's talk about smoking because a lot of people are
Mm.
stressed and they feel like smoking kind of takes the edge off. But tell us what smoking can do in addition to the stress, or just smoke if someone's say, well, I'm not stressed, I just like smoking cigarettes. How can that affect our teeth?
If you if you want to lose 4 or 5 teeth real quick within the span of 3 or 4 years, you'll start smoking 2 packs, 1 pack, 2 packs a day. True. And this is why. If you ever go, when you go to, next time you go to the gas station and you look where they keep the cigarettes,
Mm-hmm.
they have to, by law, keep a sign that says, can create dental problems, can function or can create the loss of teeth. They have to put that sign up. So the next time you go, look at that.
Now
The
I'm gonna
thing
go
that
look.
I say, oh yeah, absolutely. They have it everywhere. They've got to have it like in the gas station where they sell cigarettes. They've got to have it in the grocery store where they sell cigarettes.
Mm.
There's a sign that says that. So, what smoking does is it actually reduces the impact that our immune system has on our gum tissue.
Okay.
So, it reduces the amount of good stem cells and good blood supply and all that stuff that can get there. So, what it does is it creates what's called an anaerobic environment. And all that means is an oxygen hating environment. When that happens, the bacteria that are functioning in periodontal disease get into that pocket. Because those bacteria love environments where there's no oxygen, they flourish and boom, boom,
Wow.
boom. It just creates this cycle, this vicious cycle. The bone is lost, the teeth start moving, the patient doesn't know it until the teeth get loose. Um, the bone just it becomes avascular, meaning that it doesn't have any blood supply around it, which means the food source is not there. So, and to
Right.
keep from nerding out or anything, I'll just say it's bad for business. So please don't do it, because if you really want to lose 4 or 5 teeth within the span of 3 or 4 years, you just start smoking heavily, and you'll lose them.
Wow. Look, you want business, but not like that.
Not like that. Not like that, because it's so avoidable. Oh, no, it's so avoidable.
Right. And
Yeah.
so let's say we're educating our teenagers about all of the things. That's probably something we really need because, most of them, unless there are other issues going on, they may not have that many issues with their teeth. But if they know, hey, this is one habit I probably want to avoid because of this, I'm sure if they knew that, they may be less likely to try it, and to continue it when they're younger. So that's something that, as a family medicine physician, when we're educating them, that's one thing we really need to make sure they understand. And honestly, a lot of people want to look great and they want to keep their teeth. So if they knew that, that may be something that may deter them from doing it. So thanks for sharing that.
You're welcome. And it makes your breath stink because of all the tar in the lungs. And the
Mm-hmm.
earlier you do it, the more you predispose yourself to oral cancers
Okay. Which we don't want those at all.
at all.
And so, are there any medications that can, affect, our dental health that, this may be common or not common? Just have you noticed anything with your practice with that?
Birth control pills are one of the things that I think that will definitely affect your dental health. They mimic what happens to your body during pregnancy with the high levels of estrogen, high levels of progesterone. So what those things tend to do is make the gums bleed a little bit more and create what's called a pregnancy gingivitis, or create what are called pregnancy tumors. I'm thinking about medications that a mom can take when she's pregnant, like tetracyclines or things like
Mm-hmm.
that, that can affect the dental development. I'm not necessarily thinking about anything else that can affect the dental health, unless it's just escaping me. But those would be the two things that stick out for me,
Okay.
to consider those two things.
Okay. And what is one thing you can think of that you feel like is a common theme that you're constantly educating people on? It could be any issue when it comes to like or any myths that you feel like you're dispelling a lot that you'd like to share. It could be one or more than one, just so we can hear it from the expert.
This has really nothing to do with dentistry, but I see it all the time because we have to screen for it. We screen for hypertension.
Okay.
And that's one of the biggest things that I always try and share with people, how hypertension is a silent killer and how it is so important to know what your number is. It's so important to monitor it. We have lots of patients that come in time and time again, but particularly the African American population that of patients that I have. Those people are older. Sometimes they're not aware of the medications that they're taking. Sometimes they are. Sometimes they don't know their values. But because I am a hypertension patient and I myself have a cardiologist, and because I have a family history of hypertension, and because I've lost family members due to hypertension, I think that it is so important for us, especially to know our numbers because we die disproportionately due to hypertension outcomes or effects of hypertension and being undiagnosed. So
Right.
that is one of the things that I want to encourage people to always know and to always be aware of. The hypertension is a silent killer. And because I have to screen for it, I don't diagnose it, but I definitely screen for it with each individual patient. Every single appointment when they
Gotcha.
come in, they know their value.
That's awesome. Again, we can't leave one without the other. You're even though you're not in, primary care, family medicine, internal medicine, like you're still making it a priority to do that screening as a part of your practice because it's super important. So
Yes.
we appreciate that.
Thank you.
So, as we come to a close, what advice do you want to leave with our audience about building a healthy family legacy? It doesn't necessarily have to be about dentistry, just, whatever your thoughts are on that.
Building a healthy family legacy. You have to give me some examples. I don't know that I have something off the cuff that I could really.
So one
I
thing that
don't.
I think about, it could be from a nutrition standpoint, like some of the habits that, and not that they did, nobody, I don't feel like anybody meant any harm to us. Some of the eating habits that we may have had, or some of the exercise habits that may not have been instilled in us. So being able to be the example of say, hey, let's try to walk 3 times, a week, or, let's go swimming, on the weekend, or, let's join a gym. Another one for me is knowing your family history. So if the more you know about your family history, and not that you should go to the doctor anyway, but when you are meeting with your primary care doctor and you're telling them about, hey, I'm seeing a lot of breast cancer, I'm seeing a lot of
Mm,
colon cancer. Is this something that I need to be concerned about getting screened for earlier? So, just kind of being open to that so we can hopefully kind of break some of those cycles that we're seeing. So, there's no right or wrong because even now there are things that we can improve on. So,
for sure. Well, I'll share this with you. I guess my word would be never be afraid to try something new. And I'll share this. When I turned 50 this year, earlier this year. And what I decided to do was to learn to swim. And so,
really,
yes, never knew how to swim. Never knew how to swim at all. Was deathly afraid because
you're
I
not
when I was 10
alone,
years
but
old.
I made that comment about the 50 because you do not. Well, 50 doesn't look like what we probably thought it looked like when we were like 6 or 7.
Exactly.
So thank
Exactly.
So thanks for not being afraid to share that because you look great. A lot of people
Thank
are
you.
afraid to share their age, and you don't have a reason to be ashamed of it. You're still here, and go on with you were saying. Don't be afraid to try something new. Share your experience.
Yeah, don't be afraid to try something new. I said this year I was going to do all things new. And so I actually committed to learning how to swim. And so even though I didn't like my hair didn't like it, I did it because I
Uh-huh.
thought I'm not going to let that hinder me. I'm not going to let that put me behind the eight ball. I mean, it's important for us all to know how to swim,
Right.
at least to be able to save ourselves, right? Even if we
Hmm.
can't save somebody else. So I guess I would say don't be afraid to try new things. Even if you got to put on your tennis shoes and go for a hike. You've never been hiking before. And hiking can mean you walk up a hill and you walk down a hill,
Right.
but you
Right.
hiked,
Look, you hike it up and then you hike it back down.
hike it down. So don't be afraid to try new stuff, even if that means getting out there and trying non-conventional things that maybe, our population of people just never did. Just don't
Right.
be afraid to try something new. Just
That
step
is
out there.
that is awesome. Thanks for sharing that. And look, thanks for being the example of that too. This has been an incredible interview. I appreciate your time, your expertise, your fashion sense, your humor. all the things that make us love you so much. So if people want to get in touch with you, come to your office, how can they get in touch with you? Maybe the name of your practice and phone number and where you're located.
Absolutely. So our website is FatimaRobertsonDDS.com. We're
Okay.
located in Allen, Texas. Our phone number here is 214-509-9011. And you can also connect with me on Instagram at Dr. Fatima Robertson.
And y'all, she's very funny. So make sure you connect with her and follow her. She will keep you laughing all the time. So
Thank you,
all
Doc.
right. So this has been another episode of Voices for a Healthy Legacy. Again, I am your host, Dr. Andrea, and we will see you at the next episode. Bye bye.
Bye.